Thank you for the opportunity to speak about our paper, Patient Reported Ever Had and Current Long-Term Physical Symptoms After Prostate Cancer Treatments. We know that prostate cancer is the most common cancer in males and that the number of cases diagnosed has increased rapidly over the last 20 years, with many more men living after a diagnosis of prostate cancer. But how are these men coping? We undertook a study to look at patient-reported outcomes after prostate cancer treatment. We surveyed 6,500 men and had responses from 3,348 of them. We measured the treatments they received and the side effects that they reported ever having or current at the time of questionnaire completion. We measured 7 major physical symptoms: impotence, incontinence, bowel problems, libido loss, breast changes, hot flashes and fatigue. And we found that 9 out of 10 men reported having at least one of these after treatment, and that 3/4 of them currently had at least one of these symptoms ongoing. The most common was erectile dysfunction, 46% of men, with 16% of men reporting ongoing urinary incontinence. This varied by treatment. Over 3/4 of men having had radical prostatectomy reported ongoing erectile dysfunction, while 28% of them reported ongoing urinary incontinence. After external beam radiotherapy, 1/3 of men reported they had ongoing bowel problems. We were also able to document the effect of ever had, currently on, and never had hormone therapy, particularly with respect to libido loss, impotence, breast changes, hot flashes, and fatigue. We knew that some of these symptoms were new. For example, 43% of men reported that erectile dysfunction was a new symptom after their treatment compared to previous. The strengths of this study are that it included all ages and included all treatments and had a longer time since previous studies. In addition, we had a large number of responses, 3,348 patients, and the patient-reported outcomes were similar to the information we had recorded on these men in the cancer registry, for example, about treatment. The outcomes also fit with patterns from previous studies. We know a weakness is that we had no normative data, but for some of the conditions like libido loss and erectile dysfunction, we had pre and post levels. The conclusions from this work are that side effects after prostate cancer treatment are multiple, common, and enduring. They represent a significant health burden on men, and services should recognise and prioritise this in patient follow-up. We feel that the information in this study will help in treatment decision-making for men and their clinicians. I want to thank the men who took part in this study, and also Prostate Cancer UK and the Health Research Board who funded this work. Thank you.